Melon. Tonight, we bring awareness to this common yet under-discussed health issue that affects a large proportion of women of childbearing age.
Uterine fibroids are benign growths of the uterus that often appear during the reproductive years of a woman. Fibroids are found during a pelvic exam. Jolenta Wairimo shares her experience of living with fibroids.
It was on 2014. I usually had some severe crampings. That's when we went to the doctor with my mom at Thika level 5. Basically, we were just checking what's up with the cramps, and that's when we did a pelvic scan, and I was diagnosed with the fibroids. By that time, I was trying to conceive, and it was getting difficult. The biggest was, I think, 5 centimeters. And the smallest was 3 centimeters. After some doctor's visit, I was scheduled for a myomectomy, and it was not very successful because they only removed 1 fibroid. And yes, I went home. The healing process was good. A year later, I went to see my gynae, who recommended me some medicine, and successfully I got pregnant. We still with some fibroids intact, but the medicine he gave me assisted me in my pregnancy journey, which was very smooth. But during birth, they had to do a CS because I had a scar. I had a myomectomy scar. I gave birth smoothly to my son, and later I was not trying to conceive, but along the way I got pregnant. But sadly, I miscarried. I was scheduled for a DNC, which is the removal of the remains from the uterus. So I did the scan, and when I went to the DNC room, I explained to the doctor, so I have the remains and I also have the fibroids inside. And when I was in the DNC room, the guy kept like pulling, like I felt like he's pulling my stomach from outside. And I told him, I think whatever you're pulling is not the remains anymore. I think you're pulling the fibroids, and it is not supposed to be like that. So I had to insist, and I explained to him what we will do. We will have to repeat the pelvic scan. We see whether actually the remains came out, or we still need to do the DNC, and that's what we did. I went back to the doctor, and when we did the scan, actually whatever he was pulling, it was the fibroids, because the remains were not there. Because I imagined if someone didn't, they had fibroids, actually the doctor could have kept pulling and pulling and pulling, and that could be fatal. Yeah. So it is good for women to keep checking their pelvic, doing their pap smear and their overall like fertility checkups. So later, after some time, then I got pregnant again and miscarried. So after the second miscarriage, that's why I knew I had to, before I get pregnant, I have to go to my gynae so that I can be given those medicine to protect my baby from the fibroids.
Dr. Nelly Bosire answers some questions about uterine fibroids.
So generally speaking, if you picked 100 women off the streets today and did an ultrasound, you're likely to find almost half of them have a fibroid. It's just not a big deal if it's not causing any problems. So symptoms vary from patient to patient, and symptoms are determined by the size of the fibroids, by the location within the uterus of the fibroid. Most women would not pay attention to their cycle unless there are issues. And this is why we really strongly tell, especially moms who are raising teenage daughters, do not normalize abnormal periods for your child. The phrase, the old tale we've had forever that, oh, it's fine, I also had heavy periods, it will pass, or when you have children, it will settle, or we need to kill those, because we are basically telling the young girls that it is okay to have abnormal periods. If a woman feels their periods are abnormal, they most certainly are. It's the opposite that becomes a problem when they don't pick out that this is abnormal. So heavy periods means that what we actually say, a whole period, if you're having a period for 3 days, 5 days, you actually aren't supposed to bleed more than a total of 100 ml in that entire period. So first of all, black women are generally more prone to fibroids than white women. That's always been a known fact. But in addition, you will actually tend to see that fibroids tend to run in families. So if someone has fibroids and you ask along the family line, you're more likely to find a sibling or a mom who's also suffered from fibroids. So we do know to that degree that there is some level of genetic involvement. Risk factors for fibroids generally include what we call not being pregnant. Pregnancy is protective. So for women who delay onset of childbearing, or women who have huge gaps between the children they bear, or women who have, especially those who have children early in life, so they have 2-3 children, by the time they're 29 they're done. When they're getting to 40, we're beginning to see them beginning to experience fibroids. So just those long periods of the uterus not being in use has been seen to actually increase the risk of fibroid development. Occasionally, they would then present with infertility. And fibroids per se don't quite cause infertility unless physically where the fibroid is located, then it is obstructing the tubes and therefore blocking them from access. So once you actually do surgery and remove that fibroid, then you actually reopen up the tubes and they should be able to conceive without issue. Fibroids are treated with consideration for many things. So care is usually very personalized to the patient. So for instance, we have somebody with heavy bleeding and they're 49 years and you know it's the fibroids that are the problem. They're almost at menopause. They're not intending to have any more children. So your treatment approach will vary. Their options may be more because there's no push to preserve fertility for such a person. So when we talk about surgery, we have multiple surgical options. You can just remove the fibroids alone, which is what is a myomectomy, which is what she went through. And this can be done either way, laparotomy, where we open up the whole abdomen, or laparoscopically, where then you can use the camera devices. So the laparoscopic myomectomy is actually very advanced skill surgery. And not very many people can do it, not just in Kenya, across the world. It's a skill that is practiced over and over and is hard to attain. So currently in the country, we do not have too many people who can do it. It's also still quite an expensive procedure in this country because of the laparoscopic equipment and how long the surgery may actually take. So traditionally, many women will still go through open surgery. And here we're just taking out the fibroids. And surgically, we aim to remove as many of the fibroids in the womb as you possibly can see with the naked eye. That's why sometimes it's easier to do an open one because you can feel the uterus and you can even see feel the ones that are hidden and be able to take them out. And the uterus will generally heal very well and should be able to subsequently carry a pregnancy. But thereafter, we look at this uterus as a uterus that has already been scarred, and therefore we prefer to do a cesarean delivery as compared to attempting a normal delivery to minimize the risk of rupture of the uterus along these healed scars. Second option will be removal of the entire uterus. And the reason for this is when you've had somebody sometimes patients can actually have multiple repeat myomectomies. You have your fibroids removed at 26, 7 years later they're back and they're symptomatic and you have to undergo surgery again because you're not going to be able to stop them from growing. We remove what we see. The small ones that we cannot see will continue to grow throughout a woman's reproductive life, and so they can still recur.
If you have fibroids or think you do, speak to a healthcare provider about the treatment that is best for you.